You, Acting President. You talk, we die. Those words are painted on the mural on the side of the Hive on Victoria Street in North Richmond. They were there before the Overdose Prevention Centre opened. These words were there before the overdose a plea from the community that had already lost 23 people in the 400 square metre area around the North Richmond Health Centre in the year before MSIR began operating in 2018. Back then, calls to 000 were constant. Ambulance sirens never seemed to stop. Residents said some days they felt like they were living in a war zone. This is a community where some of the poorest Victorians live alongside some of the wealthiest. And for more than 30 years, policing and punishment have done nothing to reduce the local drug market or ease the suffering of people dependent on heroin. Today, ambulance call-outs have halved within 1 kilometre of the centre. Yet just a kilometre from here, drug-related ambulance call-outs are increasing. The MSIR now supports around 230 clients a day. It is one of the busiest and best medically supervised injecting facilities in the world. It is world-class because it provides direct pathways to support. For hundreds of people, it has been the beginning of recovery. For thousands, it has meant access to opioid replacement therapy, life-saving hepatitis treatment, mental health care, and housing support. For many, it is the first time someone genuinely asked how they are and cared about whether they live or die. We should be proud of what we have achieved here in Victoria, and we should be expanding this model. Because here in our state, overdose kills nearly twice as many people as road accidents. In 2024, 584 Victorians died of an overdose. That same year, 281 Victorians died on Victorian roads. We rightly spend billions of dollars on road safety, of course we do. But when it comes to preventing overdose and reducing drug harm, our investment in that is pittance. It is unacceptable that governments continue to commit far more to policing than to treatment, prevention and harm reduction combined. Less than 2% of Australia's illicit drug budget goes to harm reduction measures such as needle exchange programs and supervised injecting facilities. So instead of talking about shutting down life-saving services like the MSIR, we should be asking what more can we do? We should be investing in community-based harm reduction services, especially in places like North Richmond, one of the poorest communities in the country, surrounded by suburbs of extraordinary wealth. Just as with road safety, we need to place services where the risks are highest and where the need is greatest. Facilities like the MSIR are only one piece of what this community deserves. The North Richmond estate needs investment. Victoria Street needs investment. The people who live there deserve safety, dignity and support. Yet we continue to hear people in this chamber and local politicians calling for the MSIR to be moved up the road to St Vincent's or closed altogether, as though this would magically fix homelessness, chronic illness and decades of neglect. And we know that it won't. To be kind, those arguments are naive. More often, they're politically motivated. What are we doing to support the small businesses struggling with costs and vacancies? Half the shops on Victoria Street are empty. Homelessness is rising. Chronic illness is rising. Yet we still argue that closing a life-saving service is somehow the solution. It is far more expensive to police drug harm than to treat it. Pathways into treatment cost less and save lives. And we have discussed in this chamber many times the enormous cost, financial and human, of criminalising drug use. Criminalising cannabis alone costs Victorians millions of dollars and stops people from seeking the help that they need. So rather than closing MSIR, we should be asking, how can we strengthen it? Can we expand access to evidence-based treatments such as hydromorphone, a pharmaceutical alternative to heroin that has proven highly effective when methadone and other opioid therapies have failed? Can we ensure medicinal cannabis is affordable for people in this community? We have growing evidence that medicinal cannabis can reduce the harms of other drug use. And while we delay, people continue to die. Within a kilometre of where we stand today, dozens of people will lose their lives to preventable opioid overdoses this year. The City of Melbourne now has the highest overdose rate in the state. And I just wanted to make mention of the opposition's position around the relationship of the school with the MSIR. Now, from my understanding of what the community have told me and what the school has told me, the school has a great relationship with the North Richmond Community Health Centre and has been a long-time supporter of the MSIR. If anything, the continued attacks by those who oppose the MSIR have far greater negative impact on that school and the children that attend that school than the Life Saving Centre itself. What we do know is criminalising and stigmatising people who use drugs harms far more than it helps. And as the mural says, you talk, we die.